Welcome to the Movement PT Coffee Cast, where we sit down and talk about physical therapy, health, and whatever else comes to mind during our coffee-infused conversations. What's going on, guys? Welcome back to the Movement PT Coffee Cast. My name's Dalton, and with me, as always, is my beautifully bearded friend, William. William, how are we doing today?
Doing pretty good, Dalton. We're switching it up here a bit, eh?
Switching it up as in?
With our beverage.
Yeah, so it's a little late. It's a little late here. We're doing a late podcast. Our guest has kids, so, we gotta rearrange the schedule. So we are actually drinking tea. So we're the PT T-cast for this episode, so don't come after us, guys. We want to be able to sleep tonight. So Will, what kind of tea are you drinking?
I've got it's like a rose petal chamomile tea. I don't know, I found it in my mom's tea cabinet, so it's pretty good. How about you?
Yeah, I'm drinking some peppermint tea, so it's soothing my soul. It's getting me ready to talk. I think it's going to be a good podcast. So, guys, we're back at it again with another interview today. Today we have Connor Massimo on. He's a physiotherapist from Peterborough, Ontario. He is the co-founder of Pulse Physiotherapy. He's doing some great things up in the Peterborough area, and we're excited to sit down and chat with him. Connor, how you doing?
Yeah, good, guys. Thanks for having me on.
No problem. Kids are in bed. It's time to
Kids are in bed just barely. Last 5 minutes right before I started chatting with you guys, so we're good to go now.
Good.
And we know you're time.
We know you're not a big coffee drinker, so it's actually fitting that we're not doing coffee today. Are you drinking anything?
Yeah, thanks for not making me feel too bad about that. I figured I'd get a lot of flack. I've never drank coffee. I've tried it. I've tried it a few times. It's just not for me. So I am substituting with an adult beverage this evening. Ransack the Universe out of Burlington.
Represent.
Collective Arts, if you guys are familiar at all. So yeah, that's gonna be my coffee for this evening. It's too late for caffeine anyway.
No, you're right. That's why we were drinking. We were doing 9:30 podcasts, and we were drinking coffee because we're like, oh, we got to stay true. And then
to do it.
I wouldn't be to bed till 2 a.m. I'm like, yeah, I can't do this anymore. So
I think it's a little different too when you're actually on placement and you have to work in the morning, then go to school. You can just kind of roll out of bed, hop over to lecture. So
just wait till you're on placement permanently. That's coming up soon, boys.
Right on, exactly. We're gonna have to make our podcast at a little more reasonable time.
Yeah.
So, Connor, why don't you just start off by kind of introducing yourself, telling our listeners a little bit about you and what you got going on in Peterborough?
Yeah, thanks. I went to school at Mac for kinesiology initially. That's where I did my undergrad, McMaster University in Hamilton, and continued on there to do my master's in physiotherapy. I know you guys go physical therapy, but we're still physiotherapy in Hamilton. And so that finished up in 2011. And then moved back to Peterborough, which is my hometown, which is just, for those of you who don't know, about an hour and a half northeast of Toronto. And I've been back here since then. I was working at a private practice initially, working for someone else at a big clinic in town. And then kind of teamed up with a good friend of mine, Adam Summers, who's another physiotherapist in town. And we opened Pulse Physiotherapy together. And that's coming up on 4 years ago now.
Wow. Awesome. Let's talk about the environment that you created at Pulse Physiotherapy. How did Pulse Physiotherapy get started in the first place? And what is the kind of experience that you're trying to cultivate in the clinic?
Yeah, that's a big part of why we started. Adam and I were both working at the same clinic together, had become pretty good friends over the years, and kind of chatted about it a few different times. And then the final straw was kind of just a few things went down at the clinic we were at that we just weren't overly happy with. And it just didn't really feel like there was anywhere for us to grow there. just professionally. So we kind of decided, we don't know a thing about business, to be honest, but I'm sure we can figure it out as we go. So we were up at Adam's Cottage, Northern Ontario, just sitting around the bonfire having a beer, and just kind of said, let's start this thing. Let's go for it. So that was about 5 years ago, probably close to now 5 years ago. So it took us about 6 months to do the business planning stages of things, and then picked it up and started off just the two of us. And we've kind of built it up from there. And now we've got 5 practicing therapists, and things are growing. So our culture is more, that was the big reason why we started, which was, we want to do something that we don't really see locally. There's a lot of big kind of up and running clinics where, it's shorter treatment times and a lot of use of physio assistants. And not that there's anything wrong with that. It's just, it wasn't for us. We wanted to do more of the one-on-one thing, kind of 1 hour initial assessments, half-hour follow-up visits, and kind of build more of a rapport with your clientele. And that's kind of what we've been going for. And I think that's been a big part of our growth is just trying to more of the personal touch.
Yeah, that's definitely something you can tell. Like, I mean, obviously we've never been to the clinic, but we've seen it on social media and stuff. You can tell that the culture and the environment that you're trying to create at the clinic is very evident. Is there certain like philosophies or things that you guys try to follow when you have someone that comes in the door?
I mean, I guess it's cliche, but you're really trying to be your best for everyone. Kind of when I chatted with the PT BC crew a few weeks ago, it was the same story as when you're in a smaller area like Peterborough, it's, you probably already have some connection to the person before they come in. So, in a bigger city like the GTA or any of the other big cities, there's a good chance that when the person walks in the door, you've never seen them before, never heard of them. But where we are in more of a rural setting, if you don't know them directly, you probably know their family members or they were referred to you by a friend. So I think that gives you a bit of a leg up initially, that they kind of know who they're going to. But it also puts that added pressure on you that you want to be at your best all the time. And I think that goes the same for everyone, but it just puts that little added pressure of really making sure that you're doing your best for your patients, because you're likely going to see them out of the grocery store or on the baseball field or something like that within the next month or two. So you really want to be at the top of your game all the time.
Also pretty obvious that you guys are really involved in the community too, right? Like you said, rural kind of area. So you guys kind of know people, but how do you guys go about trying to get involved with the community? And why do you think that's valuable for physiotherapists to kind of get more involved in the communities?
Yeah, I think we do make an effort to do that. We work with one of the local junior lacrosse teams here, so that keeps us busy throughout a lot of the summer months. And then we do a few different community events. We've got a charity golf tournament coming up that we're a sponsor of. We do a dragon boating race, which is a fundraiser for breast cancer locally. So all the money goes to the Peterborough Hospital. So yeah, we try to put ourselves out there as much as we can. Why is that important? I think because we're kind of still the new guys in town. It's been 4 years now, so some people are starting to hear more about us. But for a lot of people, that's just a good time to kind of provide some exposure to the community of who we are, and rather than just seeing the Pulse Physio logo, actually kind of putting faces to the logo, and just kind of striking up some regular conversations, not always about physio, but just about day-to-day stuff, and just letting people get to know you a little bit, I think really helps with the branding piece of it, right? Because yeah. I think for a lot of people that have never been to physio or physical therapy, the branding of physio itself can be a bit of a struggle. So just putting yourself out there and chatting about what you actually do in the clinic, I think can be really helpful.
Yeah, and even it just kind of sets that, starts building somewhat of that alliance before they even step in the door. Not like, even if it's not that person that you're seeing, if it's a family member of that person that you're talking to and they're relaying information like about your clinic to them, like when they walk through the door, they're probably already, have a decent mindset around what to expect and what kind of people at least they're dealing with, right?
For sure. Yeah. And just even the number of husband, wife, or spouse couples that we treat is kind of crazy, just being in a smaller local area. So, that kind of sets up a bit of a different expectation for treatment, as well as, my husband came in and this is what he had for physio, and he got better. And sometimes it's striking those conversations early that, this is, it's a different injury. You're a different person. Just because your husband, responded well to those types of treatments doesn't mean it's going to be the exact same for you. So just being clear on that early on, I think, can be really helpful. But then, like you said, I think it can give you a bit of a level up just to, already have this reputation that you were helpful in some way, or you provided some kind of resource for that person as they were kind of recovering from an injury or what have you.
So obviously you guys are doing, pretty well. You guys are extending the Pulse brand to Pulse 2.0. What is what's that all about, and when are you guys going to be up and running with that?
Yeah, we're excited about it. We have been working on an expansion for the better part of 6 months now. So it kind of became obvious over the past year that we were outgrowing our space quicker than we thought we would. So it's definitely a good problem to have, but not one that we thought we'd run into this soon anyway. So we know the landlords of the plaza that we're in quite well, and they actually own the plaza, and they own the business that was adjacent to ours, and they were willing to move their business to allow us to expand.
Wow.
Which was pretty awesome of them to do. So the renovation's almost done. We're adding a good chunk of space to our clinic, and a nice big open gym space, which is what we're really most excited about. Definitely more treatment rooms as well, but definitely what I'm really looking forward to is more space to get people moving. Because when it was just Adam and I, we have this small little gym space that worked well. But now if there's 4 or 5 of us in the clinic at the same time, it doesn't work so well.
Yeah.
So yes, getting a brand new a new bench we got coming. We've got a second squat rack coming, and yeah, so those are the things we're looking forward to, as well as just a separate studio space. So we're going to kind of do some rentals to local yoga instructors, Pilates instructors, things like that, just to provide more space to get people moving.
That's super cool. Like, are you gonna have like an open turf area, or is it just gonna be more squat racks and that kind of thing?
Yeah, we talked about turf, and it kind of got ex-nayed just because it's right in the middle of the clinic. So you just for honestly the mobility piece of it, I just kind of started picturing some of my clientele that are, in wheelchairs or walkers, or any mobility issues, and not really wanting that to be their introduction to physio, that you've got to now navigate across turf to get to your treatment room on day one.
Yeah.
But that was just purely just a setup of our clinic.
Yeah.
So we're just going to go with just a hard rubber floor throughout the whole gym area. So it'll be good to drop weights on, but people won't have too much trouble navigating it either.
Nice. But yeah. I do feel like we have to talk about the squat rack. When I saw the squat rack on your Instagram page, I was so pumped up, especially with the camo and stuff on the plate. But
we get a lot of use out of it. I did a post on Instagram a few weeks ago just saying that the squat rack is my favorite modality.
Yeah.
We've I was joking with one of my clients the other day, and they said, aren't you going to put ultrasound on this? And I said to them, kind of jokingly, but actually fairly serious, that I don't really know how to use our machine. We bought it just because we kind of thought we had to, and now I wish we hadn't, because I haven't used it in the close to 4 years that we've been there. I haven't turned it on yet. So that was an expensive purchase that I should have just maybe held off on day one.
Could have bought some more plates and dumbbells and stuff.
Yeah, could have bought even another squat rack.
Could try selling it on Kijiji.
You know what? I'm sure there'd still be some takers out there. And not to knock ultrasound. I know there's still a time and a place for it. I just haven't found the time or the place for it.
Fair enough.
Do you have people coming and asking for it specifically at times?
Yeah, we've had that. And I know some of our clinicians use it sparingly. And when we chat about why they're using it, it's usually for that reason, right? It's usually a previous experience, and no matter how much education you provide, you can't get them off that idea that was what got them better. So at the end of the day, is that really harming them? Probably not. Is it helping them? Probably just in that placebo way. But I think if you're, honest about explaining that to them, and, if they're interested at all, chat a little bit about what the research may be for it or against it. And then really it's kind of up to the therapist and the patient at that point. But I think when we see people use it still the odd time, that's, I think, mostly the reason.
Yeah.
In a similar vein, how have your patients responded to the squat rack?
Yeah. I think well, in general. I think it's, just putting it out on social media has drawn more of that kind of athletic population to our clinic for sure. Which that wasn't my intention with having it. It really was just to get everyday folks using it, because there's so much research to show the benefits of, for example, deadlifting for back pain, or, if you want to look at someone's squat and they're complaining of pain with squatting, and all you can do in the clinic is have them do a body weight squat, that's probably not going to give you all of the information that you need. I have a lot of folks who, come in and they're, I squat however much weight, and it's only when I'm in that, RPE of 7 or 8 that I start to run into low back pain issues, right? So for me to have them do a body weight squat, or even to have a couple dumbbells in their hand and do a squat, they're going to be at a 2 or a 1 on their RPE, and it's not going to give me any information. They'll tell me, yeah, it doesn't hurt to do that. I look at their patterning and it looks fairly good, right? Whatever that means, but doesn't look like there's any, major obvious flaws in their movement patterns, until we load them up with some weight, and then we start to see some things potentially break down. But previous to about a year ago, when we got the squat rack, I just wasn't able to properly assess those clients. And I also found it annoying, having to kind of outsource, or actually I ended up starting to go and meet people at their gyms, to take them through the stages of an ACL rehab, for example, because, you could get through maybe month one or so without any weight, but after that, you better be loading people and loading them appropriately, and body weight just isn't going to cut it in most of those cases.
Yeah, I think you're missing out on the opportunity to really empower people too. It doesn't even have to necessarily be the squat rack, but I find even if there were just 30-pound kettlebells at some places where, you can show somebody, look, I think you're ready to start getting some serious loading here. Let's try it out. And you're there actually helping them and showing them look, you can do this and you can tolerate this level of intensity and that kind of thing. I think is something that we could really benefit from a profession, from just having those options, even if you don't do it every time.
How often do you hear people complain about, pain with lifting their kids or their grandkids? It's such a, we hear that every week, almost every day probably. So you got to have something that weighs at least as much as their grandkids, right?
Yeah.
And show them that, it's very safe to be doing that. And if they have some pain with it, maybe there's some different strategies they could use to do the lift, and then kind of build their capacity that way. If you can get someone lifting, say they have a toddler at home that weighs 20, 25 pounds, and you can get them lifting a kettlebell that's 35 pounds for reps, then all of a sudden, the lights are starting to go off in their head. The wheels are spinning, right? That, why can't I lift my grandson then? This actually weighs more than them, and I'm lifting it consecutively, 8 or 12 times, right? So I think it's really powerful to be able to provide that load within the clinic space. Plus, like I said, I just got tired of having to go meet people at their gyms.
Yeah.
I don't really know if it was legal, to be honest.
Some good points.
I'm like, I don't know if these gyms are happy with me providing advice while I'm here. I was kind of like in workout here myself, just like trying to slide by.
Well, good for you for doing that, though.
Yeah, that's awesome.
Well, I mean, you have to, right? If you want to provide that care. I didn't want to just, we have some good trainers and strength coaches in town, but I'd like to be able to kind of bridge that gap myself and not always have to refer out to someone.
Yeah.
And that's really what I'm most excited about with the expansion, is just having like a proper gym space.
Yeah, that's exciting. I'm pumped for you guys.
Thanks.
So, I mean, I see you all over Instagram. You're deadlifting, you're squatting, you're doing pistol squats on beams. You're in the park, like you're doing all this crazy stuff. What is some of your exercise philosophies, and how does that translate into what you do in the clinic, or does it at all?
Yeah, I think it definitely does. I think if it didn't, you'd be lying to yourself probably. I think we all are biased, right? We want people to like to be active. And, for 99% of the folks that went into physical therapy school, at some point in their life, and probably still, they are active in some way, whether they're runners or competitive athletes or, so many different types of sports that people still play into their adult years. For me, I play hardball still. There's a men's hardball league in Peterborough, so that keeps me busy all summer. I retired the hockey skates a while ago because I'm just not very good. So the odd charity tournament, I get out there and ankle burn a little bit, but otherwise I go to the gym throughout the winter, and I like to mix it up as much as I can. I go to a training facility in Peterborough called Hybrid Fitness Health Promotion, Fitness, Health, and Performance, and it's kind of like what you were picturing when you wanted me to have turf in my clinic. They've got the turf there and the squat racks and everything. So I train there 2 or 3 times a week myself, just to try to keep active. And then when I'm bored, I just try to go find a playground and do some kind of amateur version of calisthenic type training. Because I can't do anything like you can do on those cool Instagram accounts.
Your muscle ups were good though. I like watching. That was good.
I'm trying to master the muscle up now. That's my next project. Nice. So I've been able to struggle through 1 or 2 on the bar, and I want to get to the rings next. That's my goal.
Nice.
So it's safe to say you kind of like exploration of movement and just kind of like trying to explore movement, that kind of thing?
Absolutely. And, when I post a video of me pistol squatting or something like that, it's not because I think everyone needs to do that or everyone would want to do that. It's just to say that people can do this, right? Mm-hmm. If you have an interest in it, and that's usually what I'll write in the comments, right? This may not be for everyone. Yeah. And the only reason I posted kind of like a how-to, progression up into doing a pistol squat was because I got so many questions when I posted a video of doing a pistol squat. So I figured, well, I'll just do a how-to video and kind of some stepwise progressions. And, people may only ever get to step 2, but they're still getting, some good unilateral loading that probably will benefit them in some way from day-to-day life or for whatever sport they're doing. So it really wasn't to show off or say, I'm able to do a pistol and you're not. It was kind of the opposite. It was, this is something that I enjoy doing. Here's a video of it. And then got a lot of feedback saying, I would like to do that too. So that was kind of me saying, well, here's how I think you could progress to doing something like this.
I love that. Speaking of social media, then we know
Yes.
obviously that's kind of how we met you. So have you found social media is like benefiting your guys' clinic?
Yes is the short answer. It's, I'm still in the early stages of kind of trying to learn what I'm doing, to be honest, with social media. Learning a lot from guys like you, to be honest, that are younger and kind of grew up more into that techie. And I'm 30, so I'm not so far out of it, but I think it takes me longer than it probably takes you guys to do some of the video editing or things like that you probably just become second nature to the younger generation, for sure. But yeah, we honestly, we hear people every day in the clinic that just, tell us that that's how they found us, or something about what we were posting, or just the culture of, what our clinic seemed to look like on social media is why they came to us versus going to someone else. So I definitely think it's been worth it. Definitely a big learning experience, and I've got a lot to learn still. And I think a lot of it, like you guys know through what you do, a lot of it is time. So we've had a kind of a crazy busy summer with one of our therapists going off on maternity leave, and the clinic expansion. And I just had a baby. Well, my wife had a baby 2 months ago, and we just moved to a new house this week. So I've kind of been finding myself just not being able to, kind of spend as many hours that I need to each week to produce the kind of content that I want to be able to. But that's what I'm looking forward to in the fall. We've got one of our therapists back from maternity leave, and a new therapist joining our team. And we're going to kind of, Adam and I and my business partner are going to kind of dial down our own clinical hours to be able to do more of the kind of clinic promotion and business side of things. And my thing is the social media. So I'm looking forward to having more time for that.
Cool. Yeah. I mean, you guys do a great job with the social media. I mean, I really love the content that you guys are putting out. And with regards to us being good at like editing video, me and Will had no idea, and we still edit the videos in the most ghetto way possible on our iPads. Like, so like we're by no means like masters of that at all.
I feel like there has to be a better way than like me opening 7 different apps to be able to do this. I'm like, is there not one app that just does this for me?
Yeah, there probably is.
I listened to a podcast with the movement maestro Shante a few weeks ago, and it was they did a 2-part series about social media. And I was happy to learn that she's got a great account, but I was happy to learn that she opens about 6 different apps as well to edit her videos. So I'm like, maybe there actually isn't a better way. So
I don't know that there is.
It just takes time, right?
Yeah. All these things take time, and like it's learning and everything, But it is definitely, for us, it's encouraging to hear that social media can help draw people towards like your clinic. I think for us, that's definitely an encouraging thing to hear.
Yeah, I think 100% it does. You don't always hear that directly, but I do hear it directly fairly often. But then just if you do any reading on marketing, a lot of it is just kind of through osmosis, right? If you're top of mind for someone when they hurt their back or when they sprain their ankle, if your brand comes to mind for them, or is one of the top 3 brands that come to mind, you're more likely to be kind of one of the brands that they look for and search for when they do their Google search. So that's our goal, is, just kind of telling people what we do, as much as you can tell them in a picture or in a 60-second video, but kind of giving people an idea of what we're all about. And we're not just a clinic where you're going to go and get a hot pack thrown on you and get some ultrasound and get some IFC. We're more about, one-on-one care and being, patient focused and really taking the time to kind of get to know people, and really having that focus on movement and activity.
Yeah. So at the university that Dalton and I go to, it's very manual therapy focused, or at least there's a lot of coverage of manual therapy in our program. So we know, obviously, you have your F camp levels. So we thought we'd just kind of talk about like, how do you yourself and maybe your clinic utilize manual therapy in your clinic?
Yeah, good question. It's definitely a part of what we do. I know there's kind of been a big backlash against manual therapy over the past couple of years on social media. And I don't in any way get offended by any of that. Adam Meekins is one of my favorite podcasts in terms of the physio world that I kind of listen to religiously. And he famously produces shirts that say manual therapy sucks. And I don't take any offense to that. I have my FCAMP, which in Canada is Fellowship of Canadian Association of Manual and Manipulative Physiotherapists. It's a mouthful. But
I didn't even know what it standed for, to be honest.
Yeah, that's it's a lot. And it's kind of drawn out. Anyways, just some letters essentially, and it in Canada it kind of takes you a while to get to that kind of designation. There's a couple ways of going about it. You can do a clinical master's program where you're kind of directly doing it for about a year with some placements at your university, and then a lot of kind of home-based work as well. I did it kind of the old-fashioned way, which is a lot of weekend courses and examinations over about a 4-year span for me. So it is quite involved, and there's a lot to it. And it's definitely not just a weekend course on how to crack someone's back or how to do a neck manipulation. There's a lot more to it than that. Those are some pieces that become part of it as you get further and further through the system. But it's not definitely not what the whole thing's about. And how often do I do a neck manipulation? It would, be very rare, to be honest. I do use them when I find a patient or a client that I think, acutely would benefit from them. And that is very low. It's never going to be no risk, but it's very low risk. A young, healthy person that's not on any medications, doesn't have any family history of stroke, so on and so forth. So, I use those skills that I've, been trained to use when I think they're appropriate. But I also treat, quite a few patients where I don't do any type of hands-on manual therapy. That happens quite often on a daily basis. There's a lot of people that I see where, I check in with them. We have private treatment rooms at our clinic, so they come to the room. I kind of check in with them, see how they've been doing in the past week or two since I've seen them, and then get right out into the gym and take a look at their deadlift or take a look at their squat. So yes, I do use manual therapy, but I don't call myself a manual therapist. I call myself a physiotherapist or a physical therapist who does some manual therapy. But I do think it's important, if you're going to use manual therapy and you want it to be part of what you do, that you have to be very honest with people about what the research is surrounding manual therapy. And I think that's where a lot of the backlash has been, and rightfully so. So when I listen to someone like Adam Meekins or any of those crew, Peter O'Sullivan, he kind of uses some version of manual therapy, meaning, he has his hands on people as he's kind of guiding them through movement. So if you want to call that manual therapy, but some of the backlash against it, I think, is that we're just using it on everyone, and we're not really explaining what the mechanisms are or what the proposed mechanisms are. Cause a lot of times we don't even know what the mechanisms are. But what the proposed mechanisms are and what we actually think we might be able to attain by using these techniques. I'm always very honest with people before I choose to use one of those techniques of, for example, a manipulation or even just a mobilization, telling them that my hope with this is that we can get some short-term pain relief for you, and that we can kind of reinforce that movement pattern with an exercise that I will show you right after we do this technique. And that if we do this technique and you don't do any of those movement patterns on your own over the next week, this technique is useless, right? So and if we didn't do this technique and you just do those movement patterns, that can be very powerful as well. My whole goal is just to give them some kind of short-term pain relief and reinforce that they are able to move, and that, they're able to move safely. But I do try to pick and choose the people wisely that I'm going to use manual therapy with, because there's some people day one that I just, you get that kind of feel, or you go through their subjective history and you just think, this has been an episode of low back pain that's persisted for years on end. What do I really think I'm going to accomplish, with a lumbar gap manipulation? Probably nothing, right? And potentially they've got a lot of kind of fear and movement avoidance already built up. Why do I have to kind of get on their back and try to manhandle it for them, rather than kind of teaching them some relaxed breathing techniques on day one that might be able to get them moving in a little bit of a less stressful way.
Wow, that covered a lot. That was awesome.
Yeah.
I didn't know if you guys were out of questions or not.
He takes a sip of his beer, finishes that question, just sips.
I
just figured if you guys had 4 manual therapy questions, I'd just try to fire through them in one answer.
You did. You knocked them all out.
No, I like how you have that narrative set. I think that's a big thing that we could really nail down, is just making sure that narrative is solid, as far as this could just provide some short-term pain relief. I found I've kind of started taking that approach. In placement, I haven't used manual therapy too often, but when I have, I've really just kind of tried to, I probably didn't say it as eloquently as you did, but just to be honest, I feel like that honesty can really help with the whole effectiveness of the treatment.
Yeah. And I think it's, as therapists, if you're trying to do your best, you're always trying to be learning, right? So, that's what you guys are doing. That's why you're making this podcast. You're trying to help people learn. Mm-hmm. And I think at the end of the day, if you're trying to be the best therapist that you can be, you've got to be always learning. So I think it'd be too easy to say, I invested a ton of time and money into kind of doing this coursework. Now I'm a manual therapist, and that's my identity as a physical therapist or as a physiotherapist. Whereas that's not how I see it. I see it as I gained a lot out of doing those courses outside of learning how to do a thoracic spine manipulation. A lot of the instructors in those courses in Ontario or in Canada are there because, sometimes they're the quote unquote kind of manual therapy gurus, but also a lot of the times they're just the most kind of evidence-based and researched therapists that there are, who happen to be involved in manual therapy, right? And these are people that are kind of moving the profession forward in a lot of ways. And I think it's easy to kind of rag on them and say, yeah, they're the old gurus, they're the manual therapy gurus, but they have so much to offer that's outside of manual therapy. And that was kind of the biggest things that I took from doing those courses were, just the clinical reasoning pieces and how to build a relationship with a client and all those things that you just pick up with doing those courses, that are far more important than your technique on doing a manual therapy technique.
Yeah. And I think we kind of talked about this a little bit before we started recording, but I think the hardest part for students is we kind of just get thrown it all at us really quick in a short period of time. And we don't really know necessarily when it fits in. And I think you kind of hit a good point, was when you're saying someone that comes in with a chronic low back pain and they're telling you all these things in the subjective, history taking, you having some experience with that, you're not necessarily going to go right to a manual therapy technique. Whereas maybe, a student, for example, myself, if you're not, you're just going to maybe go right to one of those manual therapy techniques because that might be all that you really have at your disposal, because that's kind of what we've been taught in school. So I think that's where it becomes, you have to kind of figure that out as you go along.
For sure. And I think along with that learning piece of kind of always growing, there's a lot less times probably in the past year or two that I've been using manual therapy on my first session with someone. Initially, when I initially got that designation of that FCAMP designation, that was kind of like, that was my thing. I'm gonna do some manual therapy on everyone. I'm gonna try to help them feel better on day one. Was, that's why we get into the profession, is we want to try to help people feel better, I think, at the end of the day. But what I've started to notice is that can kind of build that expectation then. Yeah. And that's not what we want to be doing. If we're trying to empower people to be, to guide their own way through a treatment plan, or to guide their own way back to movement or back to whatever the activity they want to do, I don't think that it's necessarily empowering to be trying to make them feel better on day one with whatever that may be. And that's a Peter O'Sullivan thing, right? Where, that can be one of the most dangerous things that we do, is decrease someone's pain, because then that can kind of build an expectation that that's what they're coming to us for, is to always give them pain relief and kind of build that reliance on us. And that's the opposite of what we want to be doing. We want to be empowering people to get better, and us just being kind of the guides along that journey for them.
It's a great point.
But, saying that, there are examples when I do use manual therapy on day one. So, I can't say that I never do. I had a client last week who, had very intense upper back and chest pain, right? I know you guys did a post on this a little while back that got a lot of love, rightfully so, that ribs don't go out of place. And I like that, because they don't, right? It would take a high impact motor vehicle accident and they would probably break before they would go out of place. But this lady, kind of upon further assessment, had a lot of, built up tension, tone, muscle, hypertonicity, whatever you want to call it, in that area, with kind of pain referring from the upper back into the chest. She'd kind of been to the emergency room, had a lot of anxiety built up around it. But also I kind of figured that, this person is someone that now is struggling just to get around day to day. And I know a technique that I believe can be helpful for her today. And that was when I did, just kind of that classic rib distraction manipulation, where you're just kind of doing what I usually call it to the patient or to the client, is you're just kind of doing a reset, right? We're not putting anything back in place. When you hear that little pop, I explain to them what a cavitation is and what it isn't. Something wasn't out of place and it's back in. It's just that it was stiff, and now for a short period of time, it's moving better. And here's the exercises that you need to do to progress and get it moving even better. And sure enough, she came back 2 days later, and this is just a case study of one. Obviously, this isn't research, but I'm just saying this is how I would use it in a clinical setting.
Yeah.
And she was pain-free, and I won't see her again, right? So that's someone where if I just gave her some exercises, which I tried to do initially, she just wouldn't move for me. She wouldn't move at all. And she just physically was in pain trying to move. And even that day walking out was a lot less painful. And, you may say, well, that builds a reliance on that technique. Yeah, potentially. And maybe I should have done it differently. But that's kind of still me as a therapist learning. And I don't feel like I did anything wrong in that case.
Mm-hmm. Yeah, I do think that's a tough thing to navigate. It's something that we've talked about a lot on the podcast, is like this idea of like navigating expectations. And I think like that is something that I wish we talked about more, is knowing, okay, this person I think has a high likelihood of becoming dependent on this type of service. So it might be not a good idea to have a lot of manual therapy day one with this person. We might have to talk about things, try to steer them towards another direction, versus someone where like it's going to be that quick, like we're going to do a little bit of this and we're going to go right to the exercise room, and that there's not going to be any dependency. I wish that's something that we talked about a little bit more.
Yeah, I think it definitely needs to be discussed more. And I think you always have to be cognizant of it when you're a treating clinician. It's something that I'm always thinking about on a daily basis. Is this going to be helpful for them in the short term? Because I have a fairly strong belief, and there's a decent research base to show that it'll probably give some short-term relief and some short-term improvement in movement. But is that short-term relief going to be outweighed by a long-term dependency on this type of service? And in those cases, that's definitely not what I want to be doing. And I don't think there's a great, outcome measure right now that will tell you that, other than just kind of the feel that you get on day one. And for this lady that I gave the example of, I kind of got the feel that she was just someone that kind of needed a little bit of help, but wasn't someone that was, there weren't a lot of kind of yellow flag psychosocial issues in the history. She had no history of pain really in this type of area. Slept at a cottage on a weird cot and kind of woke up this way, and was really struggling. And when I think back on it now, maybe I just needed to let her kind of grind it out a bit more and reassure that it would get better no matter what I did. But in that case, I just chose to use a technique that I knew would kind of get her through the weekend and get her feeling a lot better. And like I said, I mean, you can kind of go back and forth on these things so many times, but when you're in the clinic, you kind of have to make a decision at that time. And you're not going to have time to go back and look up research while you're there. The research in the back of your head, but you want to make a decision. And for me, that's kind of the one I wanted to make that day. And I don't feel bad about it, to be honest. Yeah.
No, it kind of leads into like our last question here. It can be difficult as a student. Like we're going to be literally done school in a week. So coming out of school, trying to kind of find those philosophies in kind of the way that you want to treat. You can get pulled in all kinds of different directions with multiple, Con Ed courses and different systems and all this stuff. What piece of advice would you, offer students or, me and Will who are going out there and trying to establish those philosophies for ourselves?
So in general, you have to try to figure out, I think, what type of therapist you want to be, right? I don't mean like, do you want to be cardio rehab versus acute care versus in the clinic? Because most people have a pretty good idea of that by the end of their school term. So, assuming you have an idea of what type of physiotherapist you want to be that way, then you have to know what kind of setting that you want to go into. Do you want to go into somewhere that's really kind of assistant based, where you have minimal time with someone? If so, then you've got to be able to know what you're going to be able to do in that kind of setting. Do you want to go somewhere that you've got more time with people to build that rapport? And if so, then if you know you're going to have the time with them, well, then how are you going to fill that time? And if you've got a good understanding of, for example, strength and conditioning, you've got a background, you've done a kinesiology degree, you've done some strength and conditioning coursework, then you probably don't need to go do exercise-based coursework after. In that case, if you do plan to use some manual therapy, then that would be someone that I would kind of guide down that program, because there are a lot of manual therapy kind of one-off weekend courses where you can go learn how to do a thoracic spine manipulation. But you guys probably already know how to do that, and I don't think you gain a lot from it. So if you're going to do that, then go to a structured program that teaches you that, but also teaches you, the clinical reasoning and the safety pieces behind it. Whereas if you got a pretty good handle on manual therapy and exercise because you've gone to Western like you guys have, then maybe, you want to kind of spin off that Dave Walton kind of pain science thing and go down take some NOI classes or things like that. And there's so much value in so many courses out there that it's hard to say, go do this and go do this or go do that. You got to kind of find what you're most interested in and that kind of stick to something, right? Because if you're always doing these kind of one-off weekend, I go do an acupuncture course for a couple weekends, or then I go do this is how you do a lumbar manipulation for a couple of weekends. And you've got all these, quote unquote tools in your toolbox, but you may not know when to use them or how to use them. So take some kind of a structured program and stick with that for a while, see where it leads you, and then go from there.
Perfect.
Cool.
Yeah, I think also just, you got to understand that you're going to take some things away from some courses, and you're going to take, and some things that you learn you're not going to use at all. And I think just it's okay to do that and to kind of feel out the different things that you may find valuable, like for your population. Again, it depends on what you're seeing, right?
Absolutely. I'm just getting into my first kind of assistant role on one of these manual therapy courses in the fall. And I kind of went back and forth. Do I want to do this? And actually listening to Dave Walton, when you guys had him on, and, thinking about changing something from within versus being able to change it from the outside looking in.
Yeah.
I think there's lots of changes that could be made to these programs to make them more evidence-based. For example, we know from a lot of the research that we can't probably be as specific as we think we want to be with some of these techniques. So just kind of keeping up with that, and maybe throwing out some of the really super specific techniques that we learn on these courses and probably never use again. I think we could probably use our time a little bit more wisely in some of these cases. And I'm not arguing that I can kind of go in there and just change everything day one by any means. But I think more and more younger people getting into some of the instructing roles and providing some feedback into what people like yourselves are thinking when they're coming out of courses or coming out of the school program for physiotherapy or physical therapy, and thinking, do I really want to do any manual therapy coursework because this is the research behind it, and I know that these, this is the way that the courses go. So I think we need to be cognizant of that as well. And I'm hopeful. I'm going to try it out, see how I like it. And I'm hopeful that, more and more younger people get into the kind of instructing roles, so that maybe we can kind of make some of those changes gradually.
Sweet. That's awesome. I think it's a great place to wrap it up. So if you want to, why don't you just let people know where they can find you on social media, where they can find your clinic and all that good stuff.
Yeah, thanks, guys. So clinic website, pulsephysiotherapy.ca. My email, if anyone wants to chat about anything, if anyone wants to bash on me for manual therapy, hate mail can go directly to Connor, CONNOR at pulsephysiotherapy.ca. Send all your hate mail there. And Instagram is probably where we're most active now on social media, is at Pulse Physio PTBO. And then we have a similar Facebook account as well, and Twitter that I rarely get on.
Cool. Perfect. Awesome. Thanks so much for coming on. We really appreciate you taking the time. I know it's been a busy time, new house, got kids, got all kinds of things going on, but we really appreciate you sitting down and talking with us.
Yeah, thanks, guys. I said this to the other crew on the podcast as well, the PT Business Corner, but I'm super impressed by what you guys are doing. When we think back to, Adam and I were chatting, when we think back to physiotherapy school, I can't imagine doing something outside of what we were doing. So very impressed by you guys. So keep up the great work, and good luck in your careers, which are starting in a matter of weeks now.
Thanks so much, Connor. That means a lot to me.
Yeah, we appreciate that. All right, we'll talk to you soon, Connor. Take care.
Sounds good. Take care, guys.